A patient walked into my office last week, and what I found shocked me. This 77-year-old retired receptionist from Wisconsin had been told by 3 different doctors that nothing was wrong. Carol came to me because she could no longer read her grandchildren's birthday cards. She could not make out the fine print in recipes. Her world was shrinking in ways that nobody around her could see. And yet when she went to ophthalmology clinics, she got the same message over and over: your eyes are aging normally, there is nothing we can do, accept it as part of getting older. What I found in her retinal imaging changed everything. She had early-stage dry macular degeneration. She had drusen, these toxic protein deposits accumulating in the macula, the part of your retina responsible for reading, recognizing faces, and seeing the world in sharp detail. And here is what devastated me most: she was exactly 5 to 7 years away from the point of no return. She was exactly at the stage where intervention could still work. But nobody had told her. The system had failed her. You are not broken, Carol. The system failed you. I tell you this story because it is happening to you right now too. Somewhere in your life, someone you love is being dismissed. Someone is being told that nothing can be done. Someone is losing their independence one blurry page at a time, and nobody is offering them hope. And the tragedy is this: there is hope. There is a solution that sits right at the intersection of Nobel Prize-winning cellular science and the most cutting-edge FDA approval we have seen in ophthalmology in a decade. But the system does not want you knowing it exists. The eye care industry profits from managing decline, not reversing it. They profit from telling you to accept what comes next. But I am here to tell you something different. Your body wants to heal. And there is a mechanism, rooted in pure mitochondrial biology, that can turn back the clock on macular degeneration and dry eye disease and diabetic retinopathy and glaucoma. This is not a miracle. It is mechanism. What I discovered about photobiomodulation changed how I practice medicine. Let me tell you what I learned at Cleveland Clinic, where I spent time with researchers who have been studying this technology for 15 years. The research is staggering. And I am going to walk you through exactly why this works, how to use it, and how to know if you are a candidate. But first, I need to paint you a picture of what is actually happening inside your eye right now. Your retina is the most metabolically active tissue in your entire body. It is a tiny powerhouse the size of a postage stamp, and it is working harder than almost any other organ you have. Every single moment of every single day, your retinal cells are burning energy, processing light, and keeping you connected to the world. These cells have more mitochondria, these tiny power plants inside your cells, than almost any other tissue you possess. And this is crucial: when those mitochondria start to falter, when they cannot produce enough energy, your retina starts to fail. Drusen accumulates like garbage piling up at a dump because your cells cannot sweep it away anymore. The inflammation creeps in. Your vision blurs. And then your doctor tells you there is nothing to be done. But what if I told you that there is a way to wake up those dying mitochondria? What if I told you that you could restore their ability to produce energy at levels you have not seen in decades? This is where red light comes in. And I know what you are thinking. Red light? Like a heat lamp? Like something from a spa? Like something that does not belong in serious medicine? I get that skepticism. But before you dismiss this, let me tell you about the 2019 Nobel Prize in Physiology or Medicine. It was awarded to 3 scientists for their discovery of how cells sense and adapt to oxygen. One of the mechanisms they discovered was precisely how red light at specific wavelengths can penetrate deep into your cells and reactivate the machinery that manufactures energy. This is not alternative medicine. This is not pseudoscience. This is cellular biology at the molecular level. And it is the most important discovery for your eye health that the medical mainstream refuses to talk about. Let me be specific about what I mean. Red light therapy, or photobiomodulation, uses light at wavelengths between 630 and 670 nanometers, and near-infrared light between 800 and 900 nanometers. These are not random numbers. These wavelengths have been studied in thousands of published papers. They penetrate through your eye tissues and reach your retinal cells, and once they get there, something remarkable happens. The light is absorbed by a molecule inside your mitochondria called cytochrome C oxidase. This molecule is essentially the terminal electron acceptor in your cellular respiration chain, the final step in the process that generates ATP, adenosine triphosphate, the energy currency that your cells live on. When red light activates this molecule, your mitochondria produce 100 to 200% more ATP than they did before. Think about that. You are not just getting a little boost. You are multiplying your cellular energy production. And when your retinal cells have that kind of energy surge, they can do something remarkable. They can remove the accumulated trash, they can reduce inflammation, they can reverse early degeneration. The evidence is overwhelming, but it is also being systematically ignored by the mainstream ophthalmology community. There is a reason for that. I want you to understand something. The eye care industry makes tremendous profit from managing vision loss. They profit from cataracts, from glaucoma surgeries, from anti-VEGF injections for macular degeneration. They do not profit from prevention. They do not profit from reversal. So when a technology comes along that can prevent and reverse early-stage macular degeneration, it threatens the entire economic model of how eye care is delivered. You are not broken. The system is broken. And I am going to show you how to fix it. The first thing I want you to understand is this: most of what you have been told about macular degeneration is incomplete. You have probably heard about ARDS vitamins, the age-related eye disease study formula with zinc and lutein and zeaxanthin. And yes, those vitamins help. They reduce the risk of progression by roughly 25%. But here is what that actually means: they slow the disease. They do not reverse it. They are a band-aid on a bleeding wound. And they work only if your mitochondria have the energy to use them. If your retinal cells cannot produce enough ATP, they cannot process those nutrients effectively. They accumulate as partially oxidized waste products. And that waste becomes drusen. So you are stuck on a hamster wheel, taking vitamins that your cells do not have the energy to use. This is why people take ARDS for a decade and still go blind. This is where the system failed them. But what if you could change the equation entirely? What if you could restore your cellular energy production first, and then those same nutrients could actually do what they were designed to do? This is the breakthrough that nobody is talking about. Before you panic, let me tell you something that will actually give you hope. There is a solution, and it is simpler than you think. It is a combination of 3 strategies working together: photobiomodulation to restore mitochondrial energy, targeted nutrition to support that energy production, and lifestyle optimization to reduce oxidative stress. Each one works on its own. Together, they are exponentially more powerful. And I am going to show you exactly how to implement each one. Let me start with photobiomodulation, because this is where the most dramatic clinical data lives. In 2023, the FDA approved a device called Luma for the treatment of dry age-related macular degeneration. This was the first photobiomodulation device ever approved by the FDA for this indication. And the clinical trial results were stunning. In patients with dry macular degeneration, the treatment improved vision by at least 1 line on the eye chart in 50% of participants. That might not sound dramatic until you understand what that means. People who could not read the line before could read it after treatment. People who were losing their independence gained it back. But here is what made this even more remarkable: the treatment reduced drusen volume, the actual toxic protein buildup in the retina, by measurable amounts. And it slowed the growth of geographic atrophy, the advanced form of dry macular degeneration where large areas of the retina simply die off, by 20%. 20% might not sound like a lot, but in the macular degeneration world, this is as good as what you get from anti-VEGF injections, and it comes without the risk of injection, without the repeated office visits, and without the pharmaceutical side effects. And this is just the beginning. The same mechanism that works for dry macular degeneration is working for dry eye disease, showing significant improvement in tear film parameters and reducing the inflammatory cascade that destroys your meibomian glands. It is working for diabetic retinopathy, where the same pathology that damages your retina in diabetes can be addressed by restoring mitochondrial function. It is showing promise for glaucoma, where some studies have demonstrated both reduction in intraocular pressure and improvement in visual field defects. Even herpetic keratitis, a painful viral infection of the cornea, has shown dramatic response to a single treatment of photobiomodulation, with pain reduction and accelerated healing. The breadth of application should tell you something important. This is not a fix for one disease. This is a mechanism that addresses the root cause of multiple eye conditions simultaneously. Your body wants to heal. All it needs is the right signal. But I want to be very clear about something that will keep you safe. Not all red light devices are created equal. This is crucial. Laser-based devices can cause thermal damage to your retina if they are not used precisely. There have been cases of vision loss in children using consumer laser-based red light devices around the eyes. I do not recommend laser-based devices for home use around the eye area. LED-based photobiomodulation devices are significantly safer because the light is non-coherent and cannot concentrate heat. The Luma device, the FDA-approved one, uses an LED-based approach. This is the path I recommend for most people. Now, the dose matters tremendously. The sweet spot is 2 to 4 joules per treatment. This is a biphasic dose response, meaning that below 2 joules you do not get enough cellular activation, and above 4 joules you start to get diminishing returns and potential side effects. Most consumer red light devices sold online claim to deliver this dose, but very few actually do. They lack the power to reach the required joule density in the treatment area. This is why clinical-grade devices, whether in-office or prescription-strength home devices, consistently outperform the cheap consumer options. The frequency of treatment matters too. The clinical data shows that 3 treatments per week for 2 to 3 weeks gets you to the therapeutic threshold. Then you can transition to maintenance protocols, typically retreatment at 3 to 6 month intervals. And here is something that surprised me: the effects can last longer than a year after you stop treatment, because you are not treating a symptom. You are reactivating the cellular machinery that drives recovery. Now, if this sounds too simple to work, I understand your skepticism. But the science is overwhelming, and I am going to show you the data. The mechanism is so well established that it has been studied in over 3,000 published peer-reviewed papers. This is not fringe science. This is mainstream cellular biology. Researchers at major institutions including the National Institutes of Health, the Veterans Administration, and yes, Cleveland Clinic, have all documented the same pathway. Red light penetrates tissue, activates cytochrome C oxidase in the mitochondrial membrane, increases ATP production, reduces oxidative stress, and triggers anti-inflammatory signaling cascades. The retina responds because it has the most mitochondria of any tissue in your body. Your retinal cells are so energy-hungry that they are the first to feel the benefit of increased ATP production. And that energy surge cascades into functional restoration. This is not a miracle. It is mechanism. And mechanism is something we can count on, because it works the same way in your body as it works in everyone else's. Let me tell you what happened with Carol. We started her on a clinical-grade LED photobiomodulation device, using a protocol of 3 sessions per week for 2 weeks. Each session was targeted at her macula, at 2.8 joules per treatment. The wavelength was 655 nanometers, in the middle of the optimal range. She came back after 2 weeks looking skeptical. She said, "I do not feel anything different." And I told her something that is important for you to hear: you are not supposed to feel something different. The treatment is working at the mitochondrial level, not at the sensory level. You might not feel it happening, but your cells are waking up. Your cellular machinery is being reactivated. The cleanup and repair processes are being triggered. Give it time. 2 weeks later, she called my office. She was crying. Not from sadness, but from relief. She could read her grandchildren's birthday cards again. Her grandson had sent her a handwritten note, and for the first time in months, she could make out every single word. She did not realize how much she had lost until she got it back. This is the moment where I want to open your eyes to something that the traditional ophthalmology world has been ignoring for years. And that is this: red light therapy alone is powerful, but red light therapy combined with the right nutritional protocol is transformative. Because here is the thing that nobody tells you about ARDS vitamins. They work at the genetic level. They work through nuclear receptors and signaling pathways that activate the genes responsible for protecting your retina. But your genes cannot express their protective function if your mitochondria do not have the energy to manufacture the proteins those genes code for. It is like having a blueprint for a house but no construction workers and no electricity to power the equipment. The blueprint is useless without the energy infrastructure to build it. This is why I want you to understand something fundamental: lutein and zeaxanthin and astaxanthin are not just antioxidant molecules. They are literally pigments that accumulate in your macula and filter out harmful blue light and reduce oxidative stress at the cellular level. But they only work if your cells have enough ATP to transport them to the right locations, to process them, to incorporate them into your outer segments where they actually protect your photoreceptors. This is the integration you are not getting from your eye doctor. Now, while that first approach works, here is a variation that works even better for people in your situation. I am talking about the cellular nutrition protocol. This is not just taking an off-the-shelf multivitamin. This is taking specific nutrients at specific doses that directly fuel the retinal mitochondria and reduce the oxidative stress that red light is reversing. Here is what the research shows you need. First, lutein at 20 mg per day. Not 10, not 15, 20. The clinical trials use 20. Second, zeaxanthin at 4 mg per day. These two work synergistically to accumulate in your macula and form a protective barrier against oxidative damage. Third, astaxanthin at 12 mg per day. This is a carotenoid that crosses the blood-retinal barrier and is more potent as an antioxidant than lutein and zeaxanthin combined. It is particularly important if you have early signs of geographic atrophy, because it specifically reduces the oxidative stress that drives cell death in the macula. Fourth, omega-3 fatty acids, specifically EPA at 2000 mg per day. Your photoreceptor outer segments are made of docosahexaenoic acid, DHA, which is an omega-3 fat. When you have insufficient omega-3 intake, your retinal cell membranes become fragile and oxidative stress penetrates more easily. EPA at 2000 mg provides the raw material to rebuild membrane integrity and also has its own anti-inflammatory properties. These four nutrients together create an environment where your mitochondria can function optimally, where your genes can express their protective proteins, and where your retina can actually heal. But here is what I want you to know about timing. The dosing protocol matters. You should take these nutrients consistently for at least 12 weeks before you expect to see the full benefit. Why 12 weeks? Because your retinal photoreceptors have a cellular turnover cycle of roughly 36 days. You need 4 complete cycles for the protective effects of these nutrients to fully accumulate in your outer segments. Before 3 months, you might not see dramatic improvements. But at 4 months, 5 months, 6 months, the cumulative effect becomes undeniable. This is why people abandon good protocols too early. They take the vitamins for 6 weeks, do not see results, and assume it does not work. But the cellular biology does not work on a 6-week timeline. It works on a 3 to 6 month timeline. You are not broken. Your body just needs time to rebuild itself. Now I want to talk about something that almost nobody addresses, and this is where the real breakthrough happens. It is the lifestyle timing protocol. Your body has rhythms that govern how it repairs cellular damage, and if you ignore those rhythms, you are fighting against your own biology. Let me explain. Your retina is active during the day, processing light, burning through ATP, accumulating oxidative stress. But at night, when you close your eyes, your retina transitions into a repair mode. This is when your glymphatic system, the cleanup system of your brain and retinal tissues, becomes most active. Your cells drain metabolic waste, including the misfolded proteins that become drusen. Your mitochondria prioritize regeneration over energy production. Your genes upregulate the proteins that repair photooxidative damage. But here is the problem: most people are bathing their retinas in blue light until the moment they close their eyes. They are on their phones until midnight. They are watching screens right until bedtime. And this suppresses melatonin, disrupts your sleep architecture, and prevents your glymphatic system from cleaning up the damage accumulated during the day. So you are essentially sabotaging the very repair process that you need most. This is where the lifestyle protocol comes in. Here is what I recommend. First, safe morning sun exposure. I want you to get 15 to 30 minutes of morning sunlight exposure, ideally in the first hour after sunrise, with your eyes receiving the light either closed or slightly open, depending on your comfort level. At sunrise, the ultraviolet index is negligible. The light is rich in red and far-red wavelengths that naturally trigger circadian rhythm synchronization and mitochondrial activation. This is not the 660 nanometer monochromatic light of the Luma device, but it is the same family of wavelengths, and it primes your entire system for the day. Second, blue light blocking after sunset. Your retina contains intrinsically photosensitive ganglion cells that respond specifically to blue light in the 460 nanometer range. These cells drive melatonin suppression. When you expose yourself to blue light after sunset, you are telling your body it is still daytime, even though it is night. Your melatonin stays suppressed. Your sleep cycle fails to initiate. And your glymphatic system cannot clean up the damage. I recommend blue light blocking glasses after sunset, or better yet, shift your screens to warm mode and turn them off at least 90 minutes before bed. Third, sleep optimization. You need 7 to 9 hours of consistent sleep in a cool, dark room. Your retinal repair processes are most active during deep sleep. During deep sleep, your intracranial pressure actually drops, allowing cerebrospinal fluid to flow through your retina more freely, washing away the metabolic waste accumulated during the day. If you are chronically sleep deprived, if your sleep is fragmented, if your room is too warm, you are preventing this cleanup process from happening. And all the red light therapy and nutrients in the world cannot overcome a broken sleep system. These three things together, morning sun exposure, blue light blocking, and sleep optimization, create the circadian foundation that allows your photobiomodulation and nutritional protocol to work at maximum efficiency. Your body wants to heal. You just have to stop fighting your own biology. Let me tell you about a protocol that I have seen work repeatedly. A 74-year-old patient came to me with early dry macular degeneration, word recognition slowly declining, and significant anxiety about his future. He was a retired engineer, the kind of person who needs to understand exactly how things work before he commits to anything. So I walked him through the mechanism first. I explained the mitochondrial dysfunction. I explained the drusen accumulation. I explained how red light reactivates cytochrome C oxidase and restores ATP production. He looked at me and said, "Show me the data." So I showed him the Cleveland Clinic research. I showed him the FDA approval letter for Luma. I showed him the peer-reviewed literature on LED photobiomodulation. After 2 hours, he was convinced. He started on the protocol. He did 3 sessions per week of photobiomodulation at 2.8 joules per session. He started the nutritional protocol: lutein 20 mg, zeaxanthin 4 mg, astaxanthin 12 mg, omega-3 2000 mg EPA. He changed his evening routine, glasses off at sunset, blue light blocking glasses on, no screens after 8:30. He committed to 8 hours of sleep in a cool, dark room. He started his day with 20 minutes of morning sunlight exposure. At 6 weeks, he called me. He said, "I am not sure if it is working." I said, "Give it 12 weeks." At 12 weeks, he called again. His voice was different. It was lighter. He said, "I can read again. My wife is calling me from across the room and I can see her clearly. My grandchildren showed me a photo album at Christmas and I could see their faces in every picture." He did not know how much he had lost until he got it back. This is what happens when you address the root cause instead of just managing the symptoms. This is what happens when you work with your biology instead of against it. You are not broken. Your mitochondria just needed to be woken up. Now, there are mistakes that I see people make over and over again, and I want you to avoid them. Mistake number 1 is taking ARDS vitamins without addressing mitochondrial dysfunction. You are essentially putting fuel in the tank without checking whether the engine can actually burn it. If your mitochondria cannot produce enough ATP, your cells cannot process those nutrients properly. You get partial oxidation, you get oxidative stress, you get drusen accumulation. You end up on a treadmill where you take vitamins year after year and slowly go blind anyway. The system told you to take ARDS, so you did. But the system did not tell you that ARDS alone slows progression only by about 25%. The system did not tell you that you needed to restore cellular energy production first. You are not broken. The system failed you by giving you incomplete information. Mistake number 2 is ignoring early drusen and thinking that dry macular degeneration is inevitable. I see this constantly. People come in, I find drusen on their retinal imaging, and I tell them that this is early dry macular degeneration. They say, "Well, my vision is still fine, I will just wait." And then they wait for 5 years. And then their vision starts to decline. And then they panic. And then they realize they waited too long, because by the time symptoms appear, the drusen is often too advanced and geographic atrophy has begun to spread. Early intervention, when you still have time to restore mitochondrial function and clear drusen volume, changes everything. This is why Carol was so fortunate that I caught her early. This is why her outcome was transformation instead of resignation. You are not broken. But your window for intervention does close, and it closes without fanfare or announcement. It just quietly closes. So if you have been told you have early drusen, do not wait. Do not think it is inevitable. It is not. Mistake number 3 is thinking that macular degeneration is irreversible. The medical establishment will tell you this. They will say, "There is no cure, manage your expectations, accept your fate." But this is not true. Early dry macular degeneration is absolutely reversible if you address the mitochondrial dysfunction at the root. The LUMA trial showed this. 50% of patients improved by at least 1 line of vision. Some improved by 2 lines, 3 lines, even more. These are not small improvements. These are people who got their independence back. These are people who went from slowly losing their vision to getting it back. Yes, advanced geographic atrophy is harder to reverse. Yes, the more degeneration has already occurred, the more difficult the recovery. But early disease, when you catch it before the widespread cell death has started, is absolutely reversible. And here is the thing, most people are never told they have early disease. They are told they have age-related changes, they are told it is normal aging, they are told nothing is wrong. Just like Carol. Just like my retired engineer. They are not told that they are at the inflection point, the moment where they can choose prevention or choose decline. This is a failure of the system. You deserve better than that. You are not broken. You were just never given the information that could have saved your vision. Let me pull all of this together for you, because I want you to walk away today with a crystal clear action plan. Here is what you need to do, step by step, starting right now. Step 1. Assess your current status. Do you have early drusen? Do you have dry macular degeneration? Do you have dry eye disease? Have you been told you have any of these conditions? If you have been told you have nothing wrong but you are experiencing vision decline or difficulty with reading or recognizing faces, that is a red flag. You need a high-resolution retinal imaging study, ideally an OCT scan, to look for drusen and to establish a baseline. You cannot treat what you do not know you have. Step 2. If you do have early drusen or dry macular degeneration, consult with an ophthalmologist who is familiar with photobiomodulation. Not all eye doctors know about this technology yet. Many are skeptical. Many are entrenched in the old model of managing decline. You need to find one who understands the mechanism and can guide you toward the appropriate device and protocol. The FDA-approved Luma device requires a prescription and in-office treatment. There are also prescription-strength home-use LED devices that deliver the appropriate dose. Step 3. If you are a candidate, start photobiomodulation. 3 sessions per week for 2 to 3 weeks at 2.8 joules per session, using LED at 655 nanometers wavelength. This is the clinical protocol. Do not use consumer red light devices. They lack the power to reach therapeutic joule density. After the initial protocol, transition to maintenance at 3 to 6 month intervals. Step 4. Simultaneously, start the nutritional protocol. Lutein 20 mg daily, zeaxanthin 4 mg daily, astaxanthin 12 mg daily, omega-3 EPA 2000 mg daily. These need to be taken consistently for at least 12 weeks. Do not expect dramatic results before week 12. Be patient with your biology. Step 5. Optimize your lifestyle for retinal repair. Get 15 to 30 minutes of morning sunlight in the first hour after sunrise. This does not require being outside, light filtering through a window works. Use blue light blocking glasses after sunset, ideally starting at 6 in the evening. Turn off screens by 9 at night. Sleep 7 to 9 hours in a cool, dark room. This is not optional. Your glymphatic system cannot function without proper sleep. And finally, step 6, retest at 3 months. Get another OCT scan at the 3-month mark to see if drusen volume is reducing, if geographic atrophy growth has slowed, if your visual acuity is improving. The science says that 3 months is the minimum time to see measurable cellular changes. Some people see improvement earlier, but the biological timeline is around 90 days. I need to pause here and say something very important. This is education. This is not medical advice. I am not your doctor. Before you start any new treatment protocol, including photobiomodulation or any nutritional supplement, consult with your own eye doctor. Tell them what you are considering. Show them the Cleveland Clinic research. Show them the FDA approval letter for Luma. Ask them if they are willing to monitor your progress. If they are not, find a new eye doctor. But do not let their skepticism prevent you from pursuing something that could save your vision. You have the right to seek second opinions. You have the right to try evidence-based interventions. The system may not be offering them to you, but you can pursue them yourself. This is your vision. This is your independence. This is your quality of life. Do not settle for less. Now, here is what I want you to understand at a deeper level. What we have been talking about today is not just about your eyes. It is about a much larger failure in how medicine is practiced in this country. We have been trained to manage diseases, not to prevent them. We have been taught to prescribe medications, not to restore function. We profit from chronic illness, not from cure. And when something comes along that does not fit that model, when something comes along that can actually reverse disease and restore function without pharmaceutical intervention, it gets suppressed. It gets ignored. Ophthalmologists do not know about photobiomodulation because nobody incentivizes them to learn about it. They do not profit from teaching patients how to activate their mitochondria. They profit from injecting anti-VEGF drugs. They profit from managing your decline. The system failed you. And the system will continue to fail you unless you take control of your own health. You are not broken. The system is broken. And you have the power to step outside it. Let me tell you what happened to Carol after 3 months of treatment. She came back for her follow-up OCT scan. The imaging showed drusen volume reduction of 14%. 14% is not trivial. In the macular degeneration world, that is measurable, significant improvement. Her visual acuity had improved from 20/60 to 20/48. She could read the bottom lines of the eye chart that she could not read before. She could read her grandchildren's birthday cards without holding them an inch from her face. She could watch her grandson play soccer and see his face clearly from the sidelines. She could read recipes without magnification. Her life had gotten bigger. Her independence had expanded. And here is what moved me most: she came to my office and she said, "You gave me my life back." I did not give her anything. Her own body gave her life back. I just showed her the mechanism. I just showed her how to wake up her own mitochondria. I just showed her that she was not broken. That the system had failed her. That there was a pathway to recovery. And she walked that pathway with discipline and commitment. Your body wants to heal. All it needs is the right signal, the right timeline, and the right belief that it is possible. There is something that I want you to really hear right now, and I want you to sit with it. The age-related eye disease that is stealing vision from millions of people is not primarily a disease of age. It is a disease of mitochondrial dysfunction. Age accelerates it, yes. Age increases the accumulation of oxidative damage, yes. But the fundamental mechanism is cellular energy crisis. Your retina is the most metabolically active tissue in your body, and when your mitochondria cannot keep up, when they cannot produce enough ATP to clear damage and maintain the intricate machinery of vision, that is when macular degeneration begins. This is why the same person can be 80 years old with perfect vision and another person can be 60 with advanced macular degeneration. It is not age. It is cellular biology. And cellular biology is something you can influence. You can activate. You can restore. Every single system in your body runs on ATP. Every single repair process, every single defense against oxidative stress, every single clearance of toxic accumulation runs on ATP. Red light therapy directly increases ATP production by 100 to 200%. Nothing else you can do, no supplement, no medication, no lifestyle change, creates as direct and immediate an increase in cellular energy production as photobiomodulation. This is why it works. This is why it is revolutionary. And this is why the system does not want you knowing about it. I want to ask you something, and I want you to answer honestly to yourself. How many times have you left a doctor's office feeling like your concerns were dismissed? How many times have you been told that your symptoms are just part of aging? How many times have you been offered no solution except acceptance and decline? If you are like most people, the answer is more than once. More than a few times. Probably many times. And you have internalized a message that is deeply harmful. You have internalized the message that your body is failing. That decline is inevitable. That there is nothing you can do. But that message is wrong. It is not your body that is failing. It is a healthcare system designed to manage illness, not to promote wellness. It is a system that profits from your surrender. And you are not surrendered. You are here, watching this, learning about mechanisms and mitochondria and cellular repair, because some part of you knows that there has to be a better way. And there is. Let me speak directly to you if you have already been diagnosed with dry macular degeneration. I know you are scared. I know the diagnosis hit you like a punch in the stomach. I know you were told that your vision would decline and there was nothing you could do to stop it. I know that you have felt the slow erosion of independence as the world becomes a little blurrier each month. I want you to know that you are not alone. There are millions of people walking this path. And millions of them have been told the same lie, that nothing can be done. But this is false. Early to moderate dry macular degeneration can be reversed. Not managed. Not slowed. Actually reversed. Vision improvement of 1, 2, 3 lines on the eye chart is not impossible. It is likely. And it starts with understanding that your eyes are not broken. Your mitochondria are tired. And tired mitochondria can be woken up. You are not broken. If you are watching this and you do not have macular degeneration but you are worried about it, if you are over 55, if you have a family history of eye disease, if you have been noticing that your vision is not quite as sharp as it used to be, I want you to understand something critical. You are at the most important moment of your life for eye health. You are at the moment before disease becomes entrenched. You are at the moment where prevention is not just possible, it is easy. You do not have to wait for a diagnosis. You do not have to wait until your vision starts to fail. You can start now. You can start with the lifestyle protocol. You can start with morning sunlight exposure and blue light blocking and sleep optimization and the nutritional protocol. You can start waking up your mitochondria before they even begin to fail. This is prevention at the level of mechanism. This is you taking control of your own biology. You are not broken. And you do not need a diagnosis to deserve the best care possible. Here is what I want you to understand about the institution of medicine. Medicine was designed to cure acute problems. Medicine was designed to set a broken bone, to remove an infected appendix, to treat an acute pneumonia. Medicine is excellent at these things. But medicine is terrible at preventing and reversing chronic degenerative disease. Why? Because chronic disease is slow. Chronic disease requires lifestyle change and mitochondrial restoration and cellular patience. Chronic disease does not come with a prescription you can fill in 5 minutes. Chronic disease requires you to take ownership of your health. And the institution does not know how to market that. The institution does not know how to charge for that. The institution does not profit from that. So the institution ignores it. The institution pretends that vision loss is inevitable. The institution tells you to accept it. But you do not have to accept it. You can choose differently. You can step outside the system. You can access the Cleveland Clinic research. You can find an ophthalmologist who understands photobiomodulation. You can start the protocol right now. You can activate your own mitochondria. You can restore your own vision. The system failed you. But you do not have to accept that failure. I want you to think about identity for a moment. Who are you? Not your job, not your accomplishments, but the essential experience of being you. And how much of that experience depends on your vision? Your ability to read. Your ability to recognize the people you love. Your ability to watch a sunset. Your ability to see your grandchildren's faces. Your ability to navigate the world independently. Vision is not a luxury. Vision is foundational to your identity. And when vision starts to fade, identity fragments. Carol told me something that broke my heart. She said, I did not recognize myself in the mirror because I could not see my own face clearly. She could see shadows and shapes, but not the fine details. And in losing the ability to see herself clearly, she felt like she was losing herself. This is not just about ophthalmology. This is about wholeness. This is about staying anchored to who you are. And if there is something you can do to prevent that fragmentation, if there is something you can do to keep your identity intact, you have a moral obligation to yourself to do it. You deserve to feel good in your own body. You do not settle for less. Now let me tell you what surprised me most when I started studying photobiomodulation. It was not just the effectiveness for macular degeneration. It was the breadth of application. The same mechanism that restores vision in dry eye disease also reduces inflammation in diabetic retinopathy. The same mechanism that clears drusen in age-related macular degeneration also reduces intraocular pressure in glaucoma. The same mechanism that accelerates healing in herpetic keratitis also improves visual field defects. What I realized is that I was not learning about a treatment for one disease. I was learning about a fundamental cellular mechanism. I was learning about how to restore mitochondrial function across multiple tissues. And if this works for the eye, which is the most metabolically demanding organ in your body, what else might it work for? What about the brain? What about heart disease? What about the immune system? What about aging itself? The deeper I went into the literature, the more I realized that I had stumbled onto something profound. I had stumbled onto the discovery of how to restore cellular energy production at the mitochondrial level. And the eye happened to be the first place where this discovery was translated into clinical practice. Your body wants to heal. And red light therapy is one of the most direct ways to give your body the signal to do it. I need to be very clear about something as we wrap up. There are limitations to photobiomodulation. If you have advanced geographic atrophy, if large sections of your retina have already died, if you have severe vision loss already, photobiomodulation can still help, but it cannot restore dead tissue. Your goal should be to prevent reaching that point. Your goal should be early intervention, when you still have the opportunity to reverse disease before widespread cell death has begun. This is why I cannot emphasize enough the importance of getting retinal imaging done now, not when your vision starts to fail. Get your baseline. Know where you stand. If you have early drusen, know it. If you have early dry macular degeneration, know it. Because knowing is the moment where you get to choose. The moment you get told, everything changes. The moment you get told, you can step outside the system and access solutions that the system is not offering. You are not broken. But your window for intervention is not infinite. It closes without warning. So act now. Let me leave you with one final image. Imagine yourself at 80 years old. Imagine looking back on your life. Imagine being in a moment where you can see your great-grandchild's face clearly. Imagine being able to read without assistance. Imagine being able to navigate the world independently. Imagine that moment, and feel what it feels like. Now imagine the alternative. Imagine being 80 and being unable to read. Imagine being unable to recognize the faces of the people you love. Imagine being dependent on others to navigate the world. Imagine that moment, and feel what it feels like. The difference between those two futures is not luck. The difference between those two futures is not genetics. The difference is mitochondrial health. The difference is whether you chose to activate your own cellular machinery or whether you surrendered to the system's narrative of inevitable decline. I am giving you the information. I am showing you the mechanism. I am telling you that reversal is possible. What you do with that information is your choice. But I want you to understand the stakes. I want you to understand that this is not just about your eyes. This is about your independence. This is about your identity. This is about the quality of every single remaining year of your life. Carol's story did not end with her 3-month follow-up. She has now been on the maintenance protocol for 8 months. She comes back every 6 months for retinal imaging. Her drusen volume has continued to decrease. Her visual acuity has stabilized at 20/40. She reads voraciously again. She sees her grandchildren. She told me something that I think about every day. She said, "I feel like I got to choose my own future. I was told I did not have a choice. I was told I had to accept decline. But you showed me that I actually did have a choice. And that choice changed everything. This is what I want for you. I want you to feel like you got to choose your own future. I want you to understand that you have more power than you have been told. I want you to step outside the system and access the mechanisms that actually work. The system will tell you that you are broken. The system will tell you that nothing can be done. The system will tell you to accept decline. But you do not have to believe the system. You can believe your biology. You can believe the Nobel Prize-winning science of cellular respiration. You can believe that your mitochondria can be restored. You can believe that your retina can be healed. Because it is true. And the evidence is overwhelming. Here is what I need from you. I need you to share this. I need you to send this to someone you love who is struggling with vision loss. I need you to send this to someone who has been told that nothing can be done. I need you to send this to someone who is silently losing their independence and accepting a narrative of decline because they do not know that alternatives exist. Because the system will not tell them. The system is designed to keep you isolated, to keep you ignorant, to keep you surrendered to their narrative. But you can break that silence. You can share the information. You can tell them that there is a mechanism. You can tell them that there is hope. You can tell them that they are not broken. You can tell them that the system failed them, but that they do not have to accept that failure. This is a moral duty. This is not something I am asking you to do for me. This is something you are doing for the people you love and for yourself. Because sharing knowledge about mechanisms, about mitochondrial activation, about cellular restoration, is an act of love. It is an act of defiance against a system that profits from your surrender. It is an act of hope in a world that is often hopeless. Let me end with this. The next time you look in a mirror, I want you to look at your eyes. Really look at them. Behind that iris, behind that lens, inside that retina, are billions of mitochondria working around the clock to keep you connected to the world. Those mitochondria have been working since before you were born. They have been working through every moment of your life. And they are tired. They are tired because the world we live in is toxic. Oxidative stress is everywhere. Blue light is everywhere. Sleep disruption is endemic. Processed food depletes the nutrients your mitochondria need. Your poor mitochondria are doing the best they can with inadequate resources. But they are not failing. They are crying out for help. They are crying out for activation. They are crying out for the signal that says, I am going to restore you. I am going to give you the energy you need. I am going to support your healing. And red light therapy is that signal. Red light therapy is you saying to your mitochondria, I hear you. I see you. I am going to activate you. And when you do that, when you give your mitochondria that signal, something remarkable happens. They wake up. They surge. They produce energy at levels you have not experienced in years. And your retina, which has been struggling in the darkness, suddenly has the power to heal. This is not a miracle. It is mechanism. And mechanism is something you can count on. You deserve to feel good in your own body. You deserve vision that lets you read. You deserve independence. You deserve to recognize the people you love. You deserve to walk through the world with clarity and confidence. You deserve all of this. And you do not have to settle for less. The system may have failed you. The system may have told you that decline is inevitable. The system may have tried to convince you that you are broken beyond repair. But you know the truth now. You know about mitochondria. You know about photobiomodulation. You know about the cellular mechanisms that drive healing. You know that you are not broken. You know that reversal is possible. You know that your body wants to heal. So do not settle for less. Do not accept the system's narrative. Do not surrender your vision. Take control. Access the mechanisms. Activate your mitochondria. Restore your health. This is your moment. This is your choice. This is your life. You deserve to feel good in your own body, and do not settle for less.